Hello, everyone. Welcome to a video series for Nerdy Wellness, where education meets advocacy. And to all our fibromyalgia friends watching, I know you recognize the face here with us. This is our good friend, Danielle. We are welcoming her to share today about Spina Bifida awareness because it's Spina Bifida Awareness Month in October. So we're excited to have her back. I know you recognize her as a co-host for our conferences, from our advocacy events in Washington, D.C. Welcome back, Danielle. I'm so happy to have you here.
Me too. Thank you for having me. Thank you for doing this.
Well, I saw your video too for the Spina Bifida Association and all the advocacy work you've been doing with the events that they host as well. And it crosses over into our chronic pain fibromyalgia community. So it's perfect because I just want people to have some more advocacy, some more education for other chronic illness communities out there.
Yeah, I mean, we just had the walk and roll Saturday, so we definitely did a lot of advocacy for that. But yeah, there's definitely a crossover with a lot of chronic pain conditions and everything with spina bifida. So it's good to be in the community with.
Well, it's good to be in the community educating people and then also kind of dispelling some of these myths also that are available. Because as I was sharing with Danielle, just learning in nursing school, all I kind of knew was maybe the differences from fetal development. And that's all that I really learned. And being in a master's prepared class, I guess, as I would need to go on further, but having someone like Danielle give me more education and other resources has been helpful because as we go along in the interview and you hear from Danielle and her story and also talking about the advocacy, we just want to get it out there that I read on the Spina Bifida Association website that more than half of the people living with spina bifida in the United States are adults. Okay, so they are adults. And that's something that we're going to talk about in this interview as well. So, Danielle, I'd just like you to start maybe with a short introduction to your story, and then we're going to kind of dive into more of the advocacy.
Yeah, so Danielle Patilli, I am in North Carolina, and I've been advocating since I was born, technically, with spina bifida in 92. I had a myelomeningocele, so that's considered the more severe type. And then I had to have several back surgeries, which is actually common in spina bifida growing up. And then I got fibromyalgia, so probably related to the surgeries since they were neurological. And then I met you to do advocacy. I connected with the Spina Bifida Association and got on the advisory council for North Carolina. And I've just been advocating on the Hill, fundraising, whatever we can to spread the word out about these conditions to make people who have them feel included and that they're understood, and also people who don't understand to try to understand better.
Absolutely. And all the advocacy is important because we're talking about education as well. Do you mind sharing a little bit on the sort of the stigmas and understanding, like people think it's more of just with children only, and now with adults as yourself and others around you? Like, have you been talking to other adults with the same condition as well?
Yeah, I mean, in the community, it's a lot of adults. Obviously, there are children, but I think because it is a childhood disease, that most of the focus was always on, okay, how do we treat the babies, which is great and obviously extremely important. But now I'm the second generation to live to adulthood. And they kind of haven't really studied that much of adults because they didn't know we were going to live this long. So the fact that we're like, hey, we should probably get some studying done. One of the issues right now is actually adults are going to sleep and not waking up. And they don't know why, but it's related to spina bifida. And we really need to get more research going to, prevent that from continuing. That's one of the issues with adults. But I guess also the clinics, most of the clinics I forget how many there are now, I think 10 for adults, but the rest of the clinics in the United States are all for children. And they accept adults because there's no place for the adults to go. but in order to treat them, you have to know what's happening in the adult body of someone with spina bifida. So that's been hard, and they're definitely trying to work on getting more clinics, but it'll take a while. Yeah.
Yeah, I remember we were addressing that because Danielle had told me about it, and I was looking it up to find, because there's a clinic list on the association's website. So I was looking through. I think I just recently looked at it too, and there's been some updates. So they seem to be adding a few more, or at least they updated those clinics to say adults. So we'll include all the links in the description for anyone out there, and please share this video for families out there, because there are clinics available in different states, and they're expanding. I mean, most of it said children when I first started looking with you. Now I'm seeing a few that updated for adults, but it's few and far between to find a specialist. And I'm sure the training at in itself takes a while. What kind of training are they providing?
For the doctors, you mean?
Yeah, I mean, this is medical education at its finest, like working hard and fast, I'm sure.
Yeah, I mean, I honestly don't know what the difference is in what they're learning from adults to children, because even where I go, they mostly treat children, even though there's a doctor for adults with spina bifida. So I think they're just trying to, we have what is it called? What is it called? Where they have our data. Duke is doing it, and that other hospitals around the United States are participating, to where the data that they're following with our blood work and all of our exams and everything are going to the National Institute of Health for birth defects, so that they can study and kind of get more things going on what's happening as we're growing older. But that is limited at whatever clinic is able to participate in that. So not everyone is in those studies, like myself.
Well, I mean, and then you said it was terrifying because people aren't waking up from sleep. So that is something they have to research as well.
Yeah, and so what we say to, like, if something were to happen to me, I want an autopsy done, because that's how they're going to find out what's happening. And unfortunately, that is pretty much so far what's the only thing that we're able to do, besides trying to push more research into this for adults.
My goodness, I have so many questions regarding that, especially like using health tech or monitoring, and maybe with smart devices, to see if there's any indication of what's going on during sleep, of air oxygenation and all this stuff that's happening. So it might be smart to like give you some sort of health monitor right now for all the adults out there, or at least anyone in these studies, to try to measure what could possibly be happening in sleep, because there's a lot that goes on with oxygen exchange and things like that too. So
yeah, and it's complex, because spina bifida is considered a snowflake disorder. So no two people experience it the same way. Like, I've met people that have the same type and the same level in their spine as me, but they are not ambulatory. I am ambulatory. So it's just like everyone is different. There's not two people that are the same, which just makes it harder to study.
And does that start from earlier in age, where it's just different across the board even earlier? Or is it more like something you see as you develop and age, that you're starting to see a dramatic difference?
No, it's pretty much when you're younger, because the higher up it is on your spine, the more likelihood of you being paralyzed. But it is most commonly in the lumbar, so which is where mine is. And so once you are at the age where you can walk, that's when they're going to know, okay, they need a wheelchair, they need braces, things like that. And that's that on top of how your spinal fluid is affected. So a lot of people's spina bifida have hydrocephalus. So they have to get shunts, and they have to have like surgeries all the time because of the shunts. That's something that is different, but very common in the spina bifida, unfortunately.
So this is an area where families do need a lot of support, because it sounds like a lot of the patient community is going to go through many surgeries. It can be intense, and there's a lot to like for families to get support initiatives. Is that also something that's being worked on, like to better support families?
Yeah, so we actually did a program where we sent baskets to some of the top hospitals here for mothers who just gave birth, and it has, information on how to connect with us, and then just like a blanket, like little things for them, but mostly to make sure that they know that there's a community out there that can help them, and like they can talk to, guide them through everything that other people have been through. And while it's a snowflake disorder and no two people are the same, we still have, so much in common when we're talking about when we deal with doctors, all of that, aspect of it. So
Well, that's an important initiative, and I think it needs to be propelled even further as showing up, because do a lot of the patients still go to the ER when there's stuff going on, or are there specialized areas like if you need more emergent care, like where do you end up going?
they usually go, I mean, if they can go to where their clinic is, which Duke has a good clinic here that most of the people I know go there. If they can get to Duke Hospital, then they will go there. But otherwise, because the problem is if they go to another hospital that doesn't really understand spina bifida, I mean, that is deadly, in a sense, if they don't know what they're doing. So, but if you have to go, you have to go wherever you can, and then hopefully get transferred there. That's what I've known to be the case with other people.
Yeah, because I've heard different stories of people ending up, I mean, even through clinicals, but the lack of knowledge, if you end up at a facility that may not understand, it can be frustrating. But as the goal is to stabilize you and get you out of the hospital situation. But if you don't understand what's going on fully, it's hard to stabilize the patient. So they get frustrated. So we need more of that information everywhere. I mean, just in general, I'm finding that in clinicals, I'm seeing more rare diseases pop up like than I even expected. I didn't expect to see rare diseases as much, but I've actually seen a handful already in just one semester and a few other semesters too. So this information needs to be available. They need to know about patient organizations, because sometimes these families don't know. So that's why this work, keep advocating, because this work is super important.
Yeah, and also not even just hospitals, but doctors in general don't understand spina bifida. Some of them don't spell it correctly. They don't know how to spell it, which it is technically a rare disease, even though that study is from a while ago, so it's probably past the limit of considered a rare disease. But yeah, doctors themselves, they don't know about at least adults with spina bifida. And like in my case, I have the more severe form, but I've had doctors tell me, oh no, you don't have that form because I look, I'm ambulatory and I don't have hydrocephalus, but I did have that form. Like just because I didn't have severe problems, you can't say I didn't have it. And so I guess they treated me like, oh, you're fine, you're good. And I actually had an injection by a doctor that, because he didn't understand spina bifida, he did x-ray guided, and you can't see the sac with an x-ray. And so he hit my sac. And instead of being like, you know what, I don't know about spina bifida, I don't know that much, like, you should go somewhere else, he wanted to do it and then caused me chronic back pain. Definitely important for doctors to learn.
Well, not dismiss. And I think that's dispelling this myth and stigma that's out there that, adults have it. Because I remember distinctly, because I called Danielle up, or I texted you right away, because my professor in one of my courses had said that it's rare for adults to have it. And then it was the experience of having, I was like, huh? And I mean, I raised my hand and asked, because I said, I know someone, I have a friend. And I was like, so I was like, where does this information exist? But this is what we're being taught. And then this is why there's an imbalance for education with healthcare providers. So especially nurses out there, we need to know this because we are at bedside with the patients. We are the best advocates on the team. So if the doctor doesn't have time to look it up, like we definitely need to understand because we're right there, listen to the families and everything above. So yes, there are adults. They may be walking, they may have other ambulatory needs, but it's we can't just generalize. Like you said, everybody looks different.
Yeah, exactly. And there's not like in the clinic, there's neurological, there's urology, there's all the different aspects of it that you can be affected by, and you're not going to know by looking at them like visually. Oh, you're going to have a urologic disorder, that you need to be checked and continuously like monitored every year because they don't know what's happening with the adult. They don't know, oh, you know what, your kidneys can be damaged with spina bifida. So let's like get your kidney levels checked every year, Yeah.
I saw that when I was doing more research. Like it's very system wide. So it's not just even in the spinal cord, but just everything that it connects to, which makes sense because our body is so complex and we're all connected in the sense of the central nervous system and all the peripheral nervous systems and how it affects all the organs. So, I mean, you mentioned some of the organ systems, but you've had to really adjust to lifestyle changes and quality of life when it came to that. Do you find that you're finding the resources, or are you kind of just learning from other patients?
I just recently, in the past maybe 5 years, found a doctor to treat me as an adult with spina bifida. I don't know if it was 5 years, but I know I talked to you when that happened. So, yeah. So the past 5 years, and then she sent me to a urologist. She was like, "Okay, you should get your kidneys checked and everything checked." Now she's my hub doctor that kind of sends me. So I don't do clinics like most people with spina bifida do, where they just go one day and they go, rounds to all the different doctors. But I at least have the different doctors too, which I didn't even know that I needed when I was younger. I didn't realize just because I'm ambulatory, like I have nerve problems, I need to be checked. They don't know what's happening with adult spina bifida. So even if there's nothing wrong, they should be checked to have that, put in the system as, okay, her kidneys are working good. Yeah. But I didn't learn that until as an adult. So.
Oh gosh, yeah, because that was just something I noticed. It was system wide, and we were talking about kidney function and checking for that, especially with medication management, because you're on medications and you have to make sure that that you're excreting, like you have good kidney function, you have good liver function, so everything's running and operating appropriately. But your medications would need to be adjusted accordingly. And so I was like, I was reading so much and I was like, wow, this is really like systemic all over with different organ systems involved.
Yeah. Yeah. And I even, luckily my spina bifida doctor is the one that was like, you should have your kidneys checked regularly, especially I'm on medicines. And, before that, I would ask, different doctors, should I get my kidney levels checked? They're like, no, it's fine. Your levels were good. But I've had, higher ratings of kidney. They have to be monitored. They have to.
Well, and I think that goes for a lot of our communities in chronic illness. I think some communities maybe already get it by default when you're talking about lupus. But I even see that for fibromyalgia, especially when you're on medications, it's always good to check your functions because of how some medications are nephrotoxic too, or more irritant than to the kidneys than other medications can be. So, and doctors don't educate patients on that. They just give you the medication and in combination, which is never really studied. So if you're on more medication, multi-medications, it could affect you differently. And, everything has to get excreted somewhere through, either the GI or the kidneys. So it's important to understand that, which is part of going to be a process later in the future. But I'm glad you're a doctor. I'm really happy that you found a provider that can kind of coordinate care and really advise you on that.
Yeah, I am very grateful to found her. I wish I did sooner, but at least now I have her to. She advocates for me with other doctors and everything, so that's definitely helpful.
Oh, that's fantastic. And I mean, it sounds like it was challenging to find someone that understood.
Oh yeah, I I mean, insurance plays a factor in where you can go to see a doctor. So I unfortunately could not go to Duke anymore. I went when I was a kid, um, but just trying to find a doctor that understood spina bifida and treats an adult. On top of that, it was very hard. I mean, I don't know any other places besides those two in North Carolina that treat adults with spina bifida.
Yeah, I mean, I've been following the conference information from so is like I just noticed the difference too with public health. So it seems like the Spina Bifida Association is the one organization that we should be following. Is there anybody else that has good information?
I think just I focus with the Spina Bifida Association. We have our chapters for each area. So like the Carolinas, like California has one. So if you're in, one of those states and you want to connect with people, besides just like finding facts and everything on the website, definitely you can look up the chapter of wherever you are. So the Carolinas, South and North are together. California's own, New York has its own. So definitely connecting in that aspect to just like let them know, hey, I have spina bifida. I want to learn more. Just get connected with people. I mean, as a teenager when I had spina bifida, I just felt like I was so alone because I was like, no one understands because it's a snowflake condition. So everyone's experiencing differently, but you can't really think about it that way because there are aspects that I experience that other people's spina bifida experience and like things that I don't experience. So they can understand, especially the whole aspect of doctors and stigmas and all of that. So it's definitely important to have a community.
Oh, yeah, a community that understands and a good national organization that's pushing for change with not only medical education, but I know that you've participated in Teal on the Hill, which almost threw me. But the advocacy component. So and it's been virtual fly-ins, right? But you've been talking with representatives about spina bifida.
Yeah, and luckily some of them either know someone with spina bifida or there is a representative that actually has spina bifida himself. So talking to those, a congressman is great because we don't have to explain too much, but definitely difficult trying to explain the whole adult aspect, but we do kind of focus on people understand more the infant baby aspect of it. So it's hard to kind of get into the adult aspect with them. But we try. And every year we do Teal on the Hill. So if anyone wants to join, definitely check out the website, Spina Bifida Association .org. It's SBA.org. And
Okay.
yeah.
We'll definitely include those links. And then I'll also make sure to include the link to their clinic page, which has the resources there to reach out and getting involved. And I mean, I just tell people too to get involved with advocacy just to support. We can support Danielle and other advocates as well, because it's important that we get the message out there and share, because that's a big gap of education that needs to close when it comes to working with adults. And it sounds like also you're advocating for increased research at the NIH and with public health then. I mean, is that one of the talking points as well?
Yeah, we definitely focus on the National Institute of Health, their birth defects department specifically. So it's spina bifida is included in that, but there are also other birth defects obviously within that center there. So that is one of the huge asks that we, at least maintain that funding there, because we need more research and preferably more funding.
Well, and more adult, like research for adults, for
Yes.
improving your quality of care.
Yeah.
Because now that you're seeing, I mean, again, the statistics are showing it's way more than half. So something, and the gap and the language that keeps being portrayed that it's just for children definitely needs to change, especially with the representatives. And any way to support that. is definitely going to be important too in advocacy. But I know is it generally always virtual for advocacy events?
Yeah, so we've done in person before, but because a lot of people are in wheelchairs and Capitol Hill is not very accessible, unfortunately. So to have like several people in wheelchairs trying to get through into a building and into an office that is not accessible is online's way easier.
It definitely is. And as we went together to DC, I recognized trying to like support everybody. And boy, is it tough. It is not friendly for accessibility at all. I remember the station, I try not to call out names right now, but like we walked out the door, it was said the disability, there was no button, no nothing to like get us out the door. I still
Yeah.
have my video on that. But
Yeah.
and the hotels were terrible. I know we booked a hotel and I think they put us in the hearing accessible room
Yeah.
when I had asked for the, accessible tub and luckily the shower only had a small lip, but still like that was rough.
Yeah. I know. Can't even get started on hotels right now because I know we had the whole conversation about how the accessible rooms are not, all on the main floor, and that's problematic.
Oh yeah. I mean,
Fire alarm.
I still think about that to this day. How in the world would we get down from like where we were? I think we are like seventh or eighth floor. I
Yeah, we
was
were up there.
we were up there and trying to figure out like if stuff doesn't work, like how, and you're supposed to call and you're supposed to get help, but none of this makes sense. And that's like a whole other conversation for disability advocates because we have documented stories of our DC trips and the struggles. The struggles was definitely real in the remarks from people. Like I know I had to be really patient, but I was getting very irritated with some of the hotel systems on it. I even sent a letter to the one that we stayed at, like the major corporation, but I never heard back. So this is stuff that has to change because it would be fantastic if all of you could go. I know there's an expense involved, but also which is challenging in itself to get people to Washington D.C. But the accessibility is such a huge issue, but it does make a difference, as you noticed, of talking to representatives in person on Capitol Hill so they can actually visually, for some reason, see the differences, hear from you in person. It does make a huge impact, but I'm glad that you're doing it virtually to make that impact.
Yeah, hopefully one day we'll do it in person once they figure out accessibility at the Capitol.
Yeah, I think because you have to like go all the way around too. It's
Right.
a mess, and like there's construction everywhere. It's
And the transportation to DC, there's not a lot of accessibility in that way.
there's a lot of work to be done for advocacy, and I don't know how it is like locally. Have you done advocacy locally in North Carolina with the chapter?
I've gone to events. I haven't gone to like congressman's buildings or anything to know how accessible that is. But I do know that like if there's certain marches or something that people in health, issues want to participate in, it's very hard and it's not very accessible. So
It definitely is hard. And then when you're also in chronic pain or you're managing other aspects of symptoms too, it's definitely impossible to enjoy. And in being in Arizona too, if you dysregulation of any temperature system of the autonomic nervous system, you cannot be outside when it's hot. It's only luckily now it's starting to cool down, but it's still the weather is a big factor in people. It's just more challenging, and bathroom situations, all that stuff is just, there's so much work to be done on the advocacy front for making things accessible, which is a whole nother conversation with Danielle and other people. I mean, we should do a panel for the conference coming up.
yeah, that would be great. That's definitely an important affects a lot of people. So
But I appreciate you talking about the advocacy effort and the work that needs to get done. Is there anything else that you wanted to share for families to know when it comes to spina bifida?
I mean, just the whole aspect of people not being alone, because it's very scary, as a mother to, hear your child has a disability, they might not walk, like, you know, there are people out there that you can talk to that have been where you are and understand. Even teenagers that have spina bifida, like there are people out there that you can talk to and just really about anything, but just knowing that you can relate to each other in that aspect, just not feeling alone and making sure there's a community around you.
A community is really important, and that's why we emphasize that and just share other chronic conditions, because we don't know, maybe there's a family with out there that's managing it as well. And so please do connect with Danielle and these organizations, because you are not alone and you don't have to do this alone. And we need more voices and families together advocating together for change, because someone may have a better idea too of things, or found other resources. If there's doctors or there's healthcare providers that want to get involved, this is a great resource to get involved and to learn, because I would love to learn more about training in the future to see how to help.
Yeah, that would be great. You'd be a great person to learn about that and have on our side.
Well, just as a nursing background, to see what gets, because again, I've seen it at the bedside of having a rare disease, like these families that come into the hospital with rare diseases, and just trying to understand. And there's obviously, I'm learning to not, in certain situations, I mean, I have to behave at this point, but it's
For
interesting
now.
to watch behind the scenes to see who looks up the information, when do they look it up, how it works with family dynamics, how often do they talk to the family about what's going on. So, because nobody likes to be in the hospital. So how do we
Right.
make this better and improve that advocacy component is important.
Yeah, definitely. And people understanding their rights and, how to advocate for themselves, or make sure you have someone advocating for you, even if you can get the advocate that's, at the hospital or whatever. But especially if you're so out of it, but you really want to make sure you're advocating for yourself, definitely having someone, whether it's someone at the hospital or someone that with you, is definitely important. Just learning how to advocate for yourself is definitely something that should be taught, honestly. That
Have
people just
you
learn it through experience.
have you found that there's a resource? Like, have you used any advocates at the hospital, or it's mostly been yourself
I
and your
use I use bring a family member, but I've had to learn the hard way, and definitely having my family with me when I know I'm like having really bad brain fog, so that they can be like, no, the doctor told you this, or because I will forget. But I definitely have learned to you have to speak up, and doctors are incredible, but they are human, so they can make mistake, and it's okay to say, hey, can you let me know why you think that, or like, question them in a way, which is hard for some people. Don't realize that that's definitely an important aspect of advocacy.
Well, I like that approach, because I mean, they may not know everything when it comes to managing, but they can help. Are there any like key phrases you've noticed that were helpful when you used in those situations where the doctors responded in more appropriately?
I think kind of just like saying things like, hey, can you just explain that to me, like what that test is for, or like why you want to order it, or why you don't think I should get an MRI or something like that. Kind of asking them to explain, not stating, "Hey, I think I need an MRI." Like usually in that cases they don't respond very, which is valid. Um, but just kind of asking questions. Questions is the most helpful that I've known.
Well, and hoping they take the time to understand, like, because you explained that you have spina bifida and this is what families can do up front to share and what you've noticed. And like coming, it's hard to always come prepared, but sometimes you need, like, yes, she has all of the healthcare team. Like, this is out of range for no, like, something's going on right now. This is why we're here, and like we're trying to figure it out, but this is our healthcare team and that we normally see, so we've been really diligent with this, so they're just trying to share as much as you can, it seems.
Yeah, exactly, which is hard if you don't have really bad symptoms while you're going there. So yeah, it's definitely, I usually will write it down, or because my brain will forget. So having a piece of paper with me, at least, that I could say, hey, can you put this in your notes? So then it saves them time because they don't have to put everything I'm telling them in notes. It's already written down. So, and it's good because they have my wording, how I worded it.
Yeah, that's important because that's your patient report. So that it's good information to have. And also, like you mentioned, having someone with you for appointments, family members, anybody that can come in and be an advocate for you, especially if you're in an excruciating amount of pain. And if there's brain fog days, we all go through that. We know that really well in the fibromyalgia community. And so trying to approach it and remember everything is all nearly impossible on those days. So having it written down and even keeping extra copies, because I just always have that extra copy available in case, because you're always like, here.
Yeah.
But still, it's like remembering or ways to like provide it, to always have it like on your phone available too as extra needed in case. It just takes a lot of preparation, which I know for our community can be frustrating, but it's important when you're walking into these situations, just to give the providers as much information as you can in advance if possible.
Yeah. Because, like we've said, that we know our bodies. They study, medicine. They know the conditions, everything, maybe, hopefully. But we are the experts on our body, so they can only treat us if we tell them and work with them as a team and say, this is what I'm experienced physically. Like, what do you think?
It's all important, and you can see the similarities across other chronic illness conditions too, of us all working together. And that's why it's important for us to all work together. I mean, not only similarities in symptoms, but we show up in these medical systems and we need to be advocates for each other, and we need to educate nicely as we can, and advocate in Capitol Hill.
Yeah, definitely.
Well, I appreciate your time today, Danielle. Thank you for joining us. And I know we have a lot of advocacy ahead of us for both communities, and all our communities coming up. So where can our friends connect with you?
On Facebook or Instagram. My Facebook, I don't know if you're posting this on Facebook, but my name, just search my name, and I'm on Instagram, DPET247.
Okay.
Or on my Facebook.
Okay, so we'll definitely tag Danielle so they can follow her and follow. We'll tag the other organizations that you're involved with as well. I know that we advocated together too with Patients Rising. We haven't been back to Washington D.C. yet, but I think it'll come around soon.
Yes, eventually we will make it happen.
It's going to happen. So I think it's just the work of like what's going on with some of the organizations too. And like you mentioned, accessibility, affordability. It's actually been nice to do it virtual, because you get a lot more people that can be involved. You don't have to travel either, which is a real pain for us.
Yeah, that's definitely something we noticed in the spina bifida community. More people are involved than doing it online because they can.
Well, and I love the work that you're doing in North Carolina for all the organizations too, as well. So thank you for joining us. Thank you to all our friends for listening in, and we'll be talking to you soon. Bye, everyone.
Hi, thank you.